Do you know something that I will never understand? Is why flies that have all of the great outdoors want to come indoors. Get out! No, don't update now. Oh, everything is going wrong. 15 minutes. Can I make a video in 15 minutes? We're about to find out. Hi guys, welcome back. If you're new here, I'm Ben. I am a registered nurse, but I make videos to help learners in practice. And today we are going to cover handover, or if you're from the US, I believe you call it report. I don't think we call it anything else other than handover. So this video is going to be in two parts. The first part is this part, and I'm going to talk about how you receive a handover and how you need to stay focused and what sort of things you can pick up in handover to then help you throughout the rest of your shift. Part two is going to be how to do a handover, and I'm specifically talking end of shift or beginning of shift handover, not the kind of clinical emergency handovers that happen regularly throughout the shift. So I think it's important to just touch on why handovers are important. Now, handovers are for students and for learners and for registered nurses, may I add, quite often the most daunting part of the shift, and I think that's probably because of the importance of handover itself. So handovers are really important because it's the point at which you are summarising the day, you are summarising the events of the shift for the patients on the clinical area. Now, just to add at this point, you will, as a student nurse, be late for shift. If you haven't already been late for a shift, you will be late for a shift in the future. Missing handover as a nurse is really quite stressful because you miss out on the activities that are going on throughout that shift that's planned ahead of you. So when students miss it, the assessor or the supervisor working with them for that shift, rightly so, does get a little bit miffed because you will have missed out on vital information, not only from your patients, but like I say, I need my water. So if you've been late for a shift, the first thing that you need to do as a student nurse is to quickly get handover of the patients that you're working with. It might not be the right time as soon as you enter that ward area to speak to the nurse that you're working with because they might be busy, but go and hunt out the nurse in charge and see if they're free to give you some kind of a rundown on what's going on the ward as well as your patients. This will look really good on your part if you have been proactive enough to go and actually seek that information out. It's a safety element at the end of the day. So when you are then working with the nurse, if you can then tell them that you've had handover from the nurse in charge about your patients, that's going to look really good. Now, I'm not suggesting that you be late in order to do that, but if you are late, then absolutely do that to cover your own back. Handovers are the point in which nurses start to plan their day. They are listening not only to their patients, but they will be listening to what's going on in the ward area, because it's really important that all staff working in that area are aware of maybe potential watchers, those patients that are really critically unwell, and also to kind of know what the workload is going to be like for that shift for everybody involved. But often what you'll find is you'll get allocated your patients from the nurse in charge, and then there'll be a little bit of a conflab that goes on afterwards between the nurses to sort of say, if you need any help today, just give me a shout. The key thing is to then support the team, support the people around you. So if you are finding that you've got a moment in your shift where you've caught up on your assessments, your paperwork, everything like that, then offer your services to maybe those other staff that are a little bit more busy than you are. Again, you're going to look good. As student nurses, throughout listening to handover, this is the point in which you are going to pick up on potential learning opportunities. Handovers will be fairly different from ward to ward, but there are some usual processes that kind of go along that I'll run through now. So on the handover itself, the process is usually, it starts with bed number, patient's name, maybe their age, patient's diagnosis if they have one, and the kind of current treatment plan that they're undergoing. On the wards that I've worked on, we have utilised the SBAR process, the Situation Background Assessment Recommendation process. It makes it just a little bit more standardised, but again, this might not happen on your ward area, but definitely listen out to how they are setting up their handover, because your day will come where you are sat there handing over to the ward staff. So within the past part of the information, the kind of historical information that's given about the patients, we'll often, like I say, house the patient's diagnosis and maybe anything that the team needs to know about them and their treatment plan. It often includes things like whether they're nil by mouth or maybe require barrier nursing. Also, if they're a new admission to the ward, then often there's a little bit of a background to the circumstance leading to their admission on the ward. Now, when it comes to the kind of A part of SBARD for me, that would usually be the assessment, so the kind of the current presentation of the patient on the ward, and that will often discuss things like how the patient's been during that shift or any kind of change changes to their treatment plan that's happened. Often you'll kind of come into a shift and maybe you've been off for a week, or you've missed 2 or 3 shifts, and so much has changed with that patient, but you know them already from their history, but things will have happened in those days that maybe you weren't there for. So definitely check in with the nursing staff for any kind of key events that have happened during the time that you've been away. And this will also kind of incorporate that physical observations of the patients, like with the assessments and any maybe results from investigations that have happened. So when it comes to talking about the future, there are many reasons why not all jobs get done. In your nursing day, it gets busy, other priorities creep up. Part of time management is knowing what can be handed over to the next shift and not feeling guilty about it. Now, during handover, the reasons handovers get quite daunting, quite overwhelming, is because often there's so much jargon that gets used. I guarantee you will get to know quite quickly what gets used on the ward that you're working on, so it is no longer so overwhelming. So there are kind of 2 lots of notes that you're going to make on your handover. They're the important parts that you need to understand straight away. So they're the important parts of your shift, i.e. maybe a theatre time for the patient, maybe they need consenting before they go, or maybe a patient is being discharged and they're waiting for their medications. For those parts, pop a little asterisk, underline it, whatever you want to do, make sure that that is really clear in your handover, that is something that you need to do. The other part that you're going to be making notes on is all of the stuff that you don't understand. So I've got a bit of a BRoll that I'm going to run now, and I need to stress that these are purely made up characters. You'll notice the first patient is called Ben, and the second patient is called James, which is my middle name. So these are purely made up from my experience of working on an oncology ward. I run through these as just examples to maybe point out some things that you will not understand and how you go about that, and then some potential learning opportunities that might not be apparent to you, but throughout hopefully this video you'll start to understand that there is much more to conversations that go on between the words that are said and the words that are not said. And being a nurse is being able to understand that middle ground. So being able to actually take verbal instruction, but then kind of already preempt the background that's going to go around that situation. Oh, morning guys, it smells nice in here. I tell you what, it's so nice when day staff come on. You can really smell clean. It's lovely. So bed 1, we've got Ben, 12 months old with his ALL, high count, I think the last count was 200 for him. Currently he is fibroneutropenic with poor weight gain, and he is positive for rhinovirus, and he's got some other previous issues to note that just to make sure everybody's aware of with his history. Overnight he's been absolutely fine. He's been really settled, not needing any oxygen, so we've usually had to give him a couple of wafts every now and again when he goes into really deep sleep, but he's been absolutely fine overnight. His blood cultures and his MPAs came back negative yesterday, so that's looking good. If he spikes, he needs his PIPTAS and AMIC with blood cultures and CRP. We need to keep his HP above 70 and platelets above 30. They were fine overnight. Sent off his urgent FBC this morning, so we'll see what that comes back with. A few other jobs for him. We need to chase his MRSA swabs. For some reason they've not come back. He's for a dietitian review today, and I'm really, really sorry, but the nurse overnight wasn't able to get his dressing change done, so that needs to get done ASAP today. So in this first example, there seemed to be a little part of that information that related the full blood count, so the FBC, of the HB, the hemoglobin and the platelets. Now, anybody that has had an oncology ward experience will know that these are really often quite important things that we monitor quite regularly in hematology oncology patients. And in a nutshell, the chemotherapy will lower the counts of those bloods. Hence, it's so important when patients are actively going through chemotherapy and immediately afterwards that we keep on top of how their blood counts are doing. So for this patient, I talked about Ben not needing any oxygen overnight. So in the nurse's brains, they're thinking, okay, so his HB might be actually okay, he might not need a blood transfusion today, or you will have noticed that he was also rhinovirus positive. And as part of that, you basically get all bunged up like a cold, and it can get quite hard to breathe. So with his MPA, his nasopharyngeal aspirate, where they put a tube up the nose and suck out a bit of snot, send it off to look at what's growing in it. If that's come back as negative for our rhinovirus, then it's looking good for the patient. So that could be an indication that he's no longer positive for rhinovirus. So there are two things. It could be the fact that his airways are nice and open now, now, or it could be that his HB, his hemoglobin, hasn't dropped astronomically overnight and he's actually okay. Point of learning for you in that kind of environment would be to link up why they're talking about a blood range or what HB and platelets are, to then be able to figure out how that has an implication on the assessment of your patient. So when you come to do the OBS, and I keep going on about this in all my videos, that it is not just doing the OBS, it is a clinical assessment of that patient that you're going to be able to pick up on all of the little signs and symptoms of maybe low platelets or low HB, and you collect all that information together, you go and have a look at the latest FBC, the full blood count, and you find out that actually yes, his HB is fine, his platelets are okay, and his OBS are stable. If on the assessments you notice that maybe he's become tachycardic or he's breathing a bit faster, then you might want to look into those bloods a little bit more. So this is where, as a student, you will begin to start piecing parts of that jigsaw together, and you start to actually understand so much more about what's going on for that patient than just doing the OBS. The nurse in charge had mentioned that he'd sent off the FBC this morning, the full blood count. That should actually be ready for you by the time you start your shift, you go out on the ward. It was urgent, they can often get done in 10 minutes. So that information will start your day off with a plan. If the HB has dropped or the platelets are dropped, you know you're probably going to have to give some kind of a transfusion later on. Bed 2, we have James. He's 3 years old and he is our new ALL, and he started his treatment. He had peripheral vinc on the 23rd. He's awaiting his portacath. And he is at high risk of tumour lysis, so he needs a 6-hour tumour lysis bloods done. We also need to chase his workup bloods too today, and we need a strict fluid balance on him because he's hyperhydrating, and he is for line insertion tomorrow morning and he needs consenting, and if he spikes he's to have his PIPTAS and then a review. Okay, so little James, our new ALL, waiting for his portacath. If you don't know what portacath is, highlight it, go and look it up when you're on the ward, and he's at high risk of tumour lysis. And he's going for his line insertion and he needs consenting. So one of the things that you could do as a student is you could chase that consenting process. Maybe not on your first day because it does entail having to speak to the doctors, and if you feel quite nervous about doing that, then I would definitely listen to a few of those phone calls before maybe doing it yourself. However, if the nurses would support you in that and the doctors are on the ward, then you could definitely raise that as just to let you know James needs consenting for his line insertion tomorrow. Are you happy to do that so we can get it sorted? Now, the thing that wasn't said in handover about James was he's obviously new. He's a new diagnosed ALL, so he's got cancer. What are you thinking as a student hearing that? So we have a new patient on the ward. He may have been there for 2-3 days. He's very young. What's going through your brain right now? A few of the things that I would pick up on is what support is available for that family. How has the carer, the mum, the dad, the aunt, the uncle, whoever it is that's looking after little James, are they getting any support? Do you need to spend maybe half an hour with them, talking through what they're feeling, what they're thinking, and maybe pointing out some nurses or doctors that can kind of help them understand a little bit more about the treatment itself and about the condition too. If you were allocated that patient as a student, and maybe you're a first year or a second or third year, these are key patients that you are going to really understand quite rapidly the process of nursing on the ward that you're in. Whatever ward it is, with a new diagnosed patient or a patient that's just come in, they will have a lot of people going to speak to them. Find out from that family if they're happy, or with the patient if they're old enough, if they're happy for you to sit in on those conversations. If it's your patient, then you definitely need to advocate for them. So being present in those conversations, however hard they are to listen to, will A, make sure that you can support that family later on, but B, really open up your ideas around not only the care but the treatments and the conditions that you're going to come across on that ward. For third years, if you had that patient, I don't know whether you noticed, but I said that he'd had his peripheral vinc the day before, on the 23rd, whenever it was. He's basically started his chemotherapy, and I did say that he's at high risk of tumour lysis with 6-hourly tumour lysis bloods. So that's definitely something as a third year or second or first year, whoever, but that's definitely something that I would urge you to A, understand what tumour lysis is and why we need to do regular bloods, but also what the plan is if anything goes wrong and what you're looking out for in your assessments. There is so much information that you will not yet be able to grasp from a handover that's just there ready ready for your taking. It does take time, it takes patience, it takes perseverance, but it takes effort from you to be able to start exploring some of the treatments, conditions, and some of the investigations, to be able to start, like I say, to piece that jigsaw together. Part 2 is going to be how you actually deliver a handover. So I'm thinking for you third years maybe that are watching in your final management placement now, and maybe you're still really nervous about doing it, completely okay, but I'll give you some hints and tips on how you can develop it and deliver an amazing, awesome handover, and you can go on your merry way. If there's anything specific to this that you want to know more about, leave a comment below and I'm more than happy to answer it in either a video or I'll respond to your comment. As always, take care of yourself and have fun.
The things that we'll do, 'cause